Hi, everyone. Welcome and thank you for joining us. I'm Jen Carroll. I'm the Associate Director of Programs at NEDA, and we're very excited today to be chatting with Laura Collins Lyster-Mensh, the Executive Director of F.E.A.S.T. Welcome, Laura.
Thank you for having me. I'm really honored.
I'm just going to start by introducing you. So, Laura, as I said, is the Executive Director of F.E.A.S.T. She is an American writer who became an activist for improved eating disorder treatment after her teen daughter recovered from a life-threatening eating disorder. Her book, Eating with Your Anorexic, is a humorous memoir of her family's experience. Laura is an affiliate member for the Academy for Eating Disorders and a recipient of the 2014 Meehan Hartley Award for Public Service and Advocacy. She has helped to found three eating disorder advocacy organizations: F.E.A.S.T, Charlotte's Helix, and Maudsley Parents. She's written four books, two on eating disorders, and in her leisure time, she tap dances and watches very, very old movies. Welcome, Laura.
Thank you. It's really a pleasure to be here.
I'd love if we could kick it off by having you tell us a little bit about F.E.A.S.T and the services that you provide to families.
Yeah, I this is my favorite topic. I'm so proud of Feast. Feast has been around since 2007 technically, but we are actually a community of families around the world who kind of got together back in more like 2002, 2003. And since then, from a handful of families, it has grown to many thousands of families around the world. And it used to be on an online forum that still exists called aroundthedinnertable.org. But it has grown to be much more. So we are not only an online forum, we are three online forums. One is the original, and then we have two on Facebook, one in Spanish. We also, in addition to peer support virtually in that way, we also have a call-in line where families can talk to or live chat with an experienced caregiver and find resources and feel heard. We have quite a lot of materials that we provide on our website. We do events as much as possible in person. We're going to have our third Feast of Knowledge, which is something we've been doing the last several years. I'm afraid COVID-19 may have collapsed that idea, but we're going to do it online on June 14th. We've done events on many continents, small and large. We do a lot of connecting people. We do a lot of advocacy. So, for example, I have a relationship with Anita. We have a relationship with the Butterfly Foundation in Australia, with EDANS in New Zealand, with BEAT in the UK, with several organizations in Canada, Mexico, you name it. We've got people and things going on in many countries, several languages, and our real joy is in empowering parents. And that's part of our name, actually. FEAST stands for Families Empowered and Supporting Treatment for Eating Disorders. Little known fact that that's what FEAST stands for. So
Yeah,
we're about education, we're about evidence-based treatment, we're about empowering families. That's what we do.
sounds like a robust community.
I would say that is definitely a good description. It's a scrappy, hardworking, grassroots, beautifully technologically savvy group of people.
You touched on this a little bit about how your events are kind of needing to adapt and change during the pandemic. I know Feast recently put out a position paper and infographic about COVID-19's effect on families facing eating disorders. Can you talk a little bit about that and what the specific challenges are that you're seeing come up?
So we, of course, like everyone, like NEDA and every other organization in the world, we saw this crisis, this current crisis, as both a real problem for the eating disorder community, um, but also an opportunity to kind of do what we do even harder. So one of the things that came up was that we were hearing from families that they were in three different stages. One is people who still, hadn't gotten treatment at all, and so they were waiting for treatment, and now that has been stopped because of the virus. Then there's people who just started treatment and now are cut off from it and need to come home and do the work of recovery. And third, there are people who have chronic disorders and families who are supporting people who have long-term illness who now are cut off from the care that was really, really vitally important. So we want to make sure that we're thinking about all three types of families.
Right.
So what we kind of came up with is recovery first, yes, even in a pandemic. And that's kind of a jaunty way to say it, but yes, that is our refrain. Recovery does not need to come to an end. It does not need to be derailed. It does not need to be put on the back burner. As a matter of fact, we are hearing from families that coming home and not having the distraction of work and transportation, the new availability of online access to their providers, and peer support are making it possible for people to do a lot of the work that was happening, in appointments and even in hospitals at home. And we're seeing families kind of buckle down and do really hard work at home. And that's something we're very good at supporting families in doing, because that we started as a group of people who were helping other families do the work at home. So that's what's going on. And I want to show you the infographic. That one of our, we depend upon our beautiful volunteers, their talents, their time. And a dad made this infographic that represents all of the things in our position statement. May I just read just the basics on this?
Yeah, of course, please.
So these are the messages that are in our position statement and are represented on this lovely infographic that Frank made for us. One is food is still medicine. All meals, all snacks, every day. And that's a core value for us. Supervision, that transitions are very difficult when you have an eating disorder, so families need to keep supervision, in mind as we're at home. Structure, very, very important to help the people in our life who have eating disorders and anxiety with structure, predictability, especially around meals and snacks and exercise. Skills. We really believe that using and learning and practicing skills like distraction and mindfulness and radical acceptance are all things that are something that at home we can all practice together with our person. Connection. We know that everyone is being disconnected from clinical meetings and that sort of thing, from our friends, from our support systems, from school, from all of that. But we are strengthening our connections with the world, and we are strengthening our connections within our homes. So connection is the next to last one. And the last one is something that's always true for Feast, is that information is power. We say that we're here for you because we've been there. And that is one of the main values that we offer to other families, is we actually do know what it's like. Nobody's experience is the same, but we can hear you, we can support you, we can validate you, and we can give you information, because we believe with information you have the power to do a great many things. You're not alone. That's our biggest message.
Laura, can you hold the infographic a little bit in front of you just so we can make sure that the camera can see the hard work that went into that? That's great.
Isn't that lovely? And it's in our colors, and he did a great job, and our volunteers are really our backbone, and it's amazing.
The infographic goes over a lot of ways that families can be strong allies. Are there any other suggestions that you have for families during this time, and how they can really be strong, effective allies for people who are in recovery or, starting that process?
I think there's a couple of things. I think that because we're a family organization, we tend to look at the illness through that frame. So we look at how can we support a person through through the commitment and the strengths of a family. And that means that each family, like I said, is unique. None of us is going to do our support in the same way, and we oughtn't. But we can be there for our people and be there for each other, and we can model, this is the biggest thing, we can model an approach to our mental health and our health overall by tolerating distress. That's the big thing we talk about. our own distress and our own distress about COVID-19. So if we can, look at the world and there's uncertainty and there's concern and it's real, just like with somebody with an eating disorder, it's real. And it's hard to cope. It's hard to tolerate that distress and uncertainty. And the work of getting through the day can be hard during this period. But when we challenge ourselves to do it the best we can, imperfectly, which is the best anyone can do, which is imperfectly, that we are modeling the kind of distress tolerance that we're also asking of our person who has the eating disorder of all ages. And I think that we all learn from adversity, and we learn from each other, and we model for each other. And I think this might be an opportunity for us to kind of poke Ed in the eye and say, this thing is not going to make you the winner here. Our person is supported and safe with us. And that's what I think that's what I'm hearing from families, even though groceries are hard to get and appointments are not happening and it's hard, and living with mental illness is a difficult thing, but we don't have to roll over and become part of the illness's support system. We can still be the support system for the person.
Yeah, it sounds like, he's just saying, here are these great resources and here's this community, and let's take this time as an opportunity to work on this together and to access these resources that can help, and to know that there's a way to get through it and hopefully even thrive through this experience and this collective experience together.
Yeah, I think we can all grow from this. Yeah. I think COVID-19 is going to be a memory for us all. And it might be a memory of really some hard and important progress in our families and in our lives.
Sure. Wow. Well, thank you so much for sharing that with us. Is there anything else that you would love for our community to know about F.E.A.S.T or about families during this pandemic?
I want to say that to other parents, I know you're frightened. I know it seems really intimidating to try to face this in your home, but I'm just really impressed by the amazing community, and you're not alone. And there are people to listen to learn from, and then also to give back, because I think the giving back is part of it. And we need you to join into the larger community and get involved. And I think it will help families to be supporting other families. And that's why we really believe in peer support.
Thank you, Laura.
You're welcome, and thank you. This is an honor, and I'm so supportive of what you're doing at NEDA to connect people during this time.
Yeah, thank you so much for your time. It's been amazing to connect and to hear about what F.E.A.S.T has going on, and we will be sure to share that infographic and information for other families.
We really thank you for that. Thank you.
All right.